in 35% of 193 patients. And in this study, in which bortezomib was compared with dexamethasone alone, the bortezomib provided a longer time to progression or survival compared to dexamethasone alone. This is a very large study from North America and Western Europe. Patients, relapsed refractory disease, were randomized to receive lenalidomide, Revlimid, or dexamethasone, or a placebo plus dexamethasone, and again, the RevDex much superior in response, 60% to 22%, and the time to progression, 11 months versus just 5 months. We have been looking at a new drug, Pomalidomide, which is not yet on the market. This study, reported by my colleague Martha Lacey, showed or contained just data from 37 patients. We've treated about 160 patients now. And the response rate for these relapsed refractory patients is running very good or partial response. That would be a total of over 60% in patients. And the good news is that the drug is quite well tolerated. And secondly, half of the patients who were initially resistant to Velcade responded, and about 40% of patients who were resistant or resistant to Revlimid responded to Pomalidomide. So it is promising. Now, you might ask the question, have we made any progress? And I think the answer to that is yes, a resounding yes. And data to support this comes from my colleague Shaji Kumar, who looked at our experience with multiple myeloma in Rochester from 1971 to 2006, almost 3,000 patients. And in those patients who were diagnosed after 1996, the survival, the median survival was 44.8 months. More than 3.5 years, compared to those patients who were diagnosed before 1996, when the median survival was about 2.5 years. This increase in survival is due to a combination of autologous stem cell transplant and the 3 new drugs. He also looked at our patients who had an autologous stem cell transplant and had subsequently relapsed. And those patients who were exposed to one of the 3 new drugs had a survival after relapse, after transplant, of 2.5 years compared to 14 months in those who, for one reason or another, most of them done before the novel drugs were available. We're living in a good time. There are a number of promising agents. There are several histone deacetylase inhibitors. One such one, Vorinostat or SAHA, is already in phase 3 studies. There's a new proteasome inhibitor that's given orally. This is the type of drug that Velcade is that has to be given intravenously, NPI 0052. There are studies on that, as well as a variety of other drugs. Another one that looks very promising is carfilzomib, and Dr. Stewart here in Scottsdale is chairing a large phase 3 study looking at this drug in detail. It's also a proteasome inhibitor. And with that, I thank you for your attention.